Autoimmune diseases. An autoimmune disease is a condition in which your immune system attacks your body. The immune system usually guards against a bacteria and a virus. When it senses these foreign invaders, it sends out an army of fighter cells to attack them. Usually, the immune system can tell the difference between the foreign cell and your own cell. In an autoimmune disease, the immune system mistakes the part of your body like your joints or skin as foreign. It releases a proteins called autoantibodies that attack the healthy cells. Some autoimmune diseases target only the one organ, that is type 1 diabetes damages the pancreas. Other diseases like the systemic lupus erythematosus or the lupus can affect the whole body. Why does the immune system attack the body? Doctors don't know exactly what causes the immune system to misfire. Yet some people are more likely to get an autoimmune disease than others. According to a 2014 study, women get the autoimmune disease at a rate of over 2 to 1 compared to men, which is nearly 6.4% of the women versus 2.7% of men. The disease often starts during the childbearing age, which is nearly the age 15 to 44. Some autoimmune diseases are more common in certain ethnic groups. For example, the lupus affects the more African American and the Hispanic people than the white people. Certain autoimmune diseases such as the multiple sclerosis and the lupus, they run in families. Not every family member will necessarily have the same disease, but they inherit a susceptibility to an autoimmune condition. Because the incidence of the autoimmune disease is rising, researchers suspect the environmental factors like infections and exposure to chemicals or solvents might also be involved. The Western diet is another suspected risk factor for developing an autoimmune disease. Eating the high fat, high sugar, and highly processed foods are thought to be linked to the inflammation, which might set off an immune response, but this hasn't been proven. 14 common autoimmune diseases. There are more than 80 autoimmune diseases. Here are the 14 of the most common one. Type 1 diabetes. The pancreas produces a hormone insulin which helps regulate the blood sugar level in the type 1 diabetes mellitus. The immune system attacks and destroys the insulin producing cells in the pancreas. High blood sugar results can damage the blood vessel on the organs including the heart, kidney, eyes and nerves. Rheumatoid arthritis. The immune system attacks the joints. This attack causes the redness, warm, soreness and the stiffness in the joints. Unlike osteoarthritis, which commonly affect the people as they get older, the RA can start as early as your 30s or the sooner. Skin cells grow and shed when they are no longer needed. Psoriasis causes the skin cell to multiply too quickly. The extra cells build up and form inflamed and the red patches, commonly with the silver white scales of a plague on light toned skin. On the darker skin, psoriasis can appear purplish or dark brown with the grey scales. Up to 30% of our people with the psoriasis also develop the swelling, stiffness and pain in the joints. This form of the disease is called psoriatic arthritis. Multiple sclerosis damages the myelin sheet, the protective coating surrounding the nerve cells in your central nervous system. Damage to the myelin sheet slows the transmission speed of the messages between your brain and the spinal cord to and from the rest of your body. This damage can lead to the numbness, weakness, balance issue and the trouble walking. The disease comes in several forms that progress at the different rate. According to 2012 study, about 50% of the people with MS need help walking within 15 years after the disease starts. Systemic lupus erythematosus. Although the doctors in 18 the first described lupus as a skin disease because of the rash it completely produces, the systemic form, which is the most common, actually affects many organs including the joints, kidney, brain and the heart. Joint pain, fatigue and the rashes are the most common symptoms. Inflammatory bowel disease. This describes the condition that causes the inflammation in the lining of the intestinal wall. Each type of the IBD affects the different parts of the GI tract. Crohn's disease can inflame any part of the GI tract from the mouth to the anus. Ulcerative colitis affects only the lining of the large intestine and the rectum. Addison disease, they affect the adrenal gland which produce the hormone cortisol and the aldosterone as well as the androgen hormone. Too little cortisol can affect how the body uses and stores the carbohydrates and sugar. Deficiency of the aldosterone will lead to the sodium loss and excess potassium in the bloodstream. Symptoms include weakness, fatigue, weight loss and low blood sugar. Graves' disease, this attacks the thyroid gland in the neck, causing it to produce too much of its hormone. Thyroid hormone controls the body's energy usage known as the metabolism. Having the too much of this hormone stirs up your body's activity, causing the symptoms like nervousness, a fast heartbeat, heat tolerance and weight loss. One potential symptom of this disease is bulging eyes called exophthalmos. It can occur as a part of Graves' ophthalmopathy, which occur in around 30% of those with the Graves' disease. According to 1993 study, the Graves' disease is the most important toxic disease which are affecting the thyroid gland. Surgeon syndrome. This condition attacks the glands that provide the lubrication to eyes and mouth. The hallmark symptoms of the Surgeon syndrome are the dry eyes and the dry mouth, but it may also affect the joints or skin. Hashimoto-thyroiditis. The thyroid hormone production slows to deficiency. Symptoms include weight gain, sensitivity to cold, fatigue, hair loss, and the swelling of the thyroid goiter. Myasthenia gravis. This affects the nerve impulses that help the brain control the muscles. When the communication from nerves to muscle is impaired, signals can't direct the muscles to contract. The most common symptom is a muscle weakness, which worsens with the activity and improves with rest. The muscles that control the eye movements, eyelid opening, swallowing, and the facial movements are often involved. Autoimmune vasculitis. This happens when the immune system attacks the blood vessel. The inflammation that results the narrow the arteries and veins, allowing the less blood to flow through them. Pernicious anemia. This condition causes the deficiency of a protein made by the stomach lining cells, which is the intrinsic factor needed for the small intestine to absorb vitamin B12 from food. Without enough of this vitamin, one will develop the anemia and the body's ability for the proper DNA synthesis will be altered. Pernicious anemia is more common in the older adults. According to the 2012 study, it affects 0.1% of people in general, but nearly 2% of the people over the age of 60. Celiac disease. Can't eat foods that containing the gluten, a protein found in the beet, rye, and other grain products. When gluten is in the small intestine, the immune system attacks this part of the gastrointestinal tract and causes inflammation. According to the 2015 study, noted that the celiac disease affects 1% of the people in the United States. Many people have reported the gluten sensitivity, which isn't an autoimmune disease but can have the similar symptoms like diarrhea and abdominal pain. Symptoms of the autoimmune disease. The early symptoms like fatigue, itchy muscles, swelling and redness, low-grade fever, trouble in concentrating, numbness and tingling in the hands and feet, hair loss and skin rashes. Individual disease may also have their own symptoms. For example, type 1 diabetes causes extreme thirst, weight loss and fatigue, causes the belly pain, bloating and diarrhea. With autoimmune disease like psoriasis or ORI, the symptoms may come and go. A period of symptoms is called flare-up. A period when the symptoms go away is called remission. Symptoms like fatigue, muscle aches, swelling and redness could be a sign of autoimmune disease. They come and go over time. See a doctor if you have a symptoms of the autoimmune disease. You might need to visit a specialist depending on the type of disease you have. Rheumatologists treat the joint disease like rheumatoid arthritis. Gastroenterologists treat the disease of the GI tract such as celiac and Crohn's disease. Endocrinologists treat the glands like Graves' disease, Hashimoto-thyroiditis and the adjacent disease. Dermatologists treat the skin conditions like psoriasis. Tests that diagnose the autoimmune disease. No single test can diagnose the most autoimmune disease. Your doctor will use a test to view your symptoms and conduct a physical examination to reach a diagnosis. Doctors often use the antinuclear antibody test when the symptoms suggest the autoimmune disease. The positive test means you may have one of these diseases, but it won't confirm exactly which one you have it or which one for sure. Other tests look for the specific autoantibodies produced in the skin. Autoimmune diseases, your doctor might also do the specific test to check for the inflammation this disease produced in the body. Bottom line, a positive antibody test and a blood test may indicate the autoimmune disease. Your doctor can use your symptoms and the other tests to confirm the diagnosis. For the treatments can't cure the autoimmune disease, but they can control the overactive immune response and bring down the inflammation, or at the least reduce the pain and inflammation. Drugs used to treat these conditions include non-steroidal anti-inflammatory drugs such as ibuprofen and the naproxen. Immune suppression drugs treatments are also available to relieve the symptoms like pain and swelling. Eating a well-balanced diet and getting the regular exercise may also help you feel better. The main treatment for the autoimmune disease is with the medication that bring down the inflammation and calm the overactive immune response. They can relieve the symptoms. Thank you.